All right, now we're going to look at the third chapter of the app, cannabisandcollegehealth.com. The third chapter is called Educate. There is no approved medication for treatment of cannabis use disorder. Education is a critical part of any substance use treatment. Education on the effects of substance use empowers the patient to consider behavior change. We were last discussing the endocannabinoid receptor, CB1, in the No section of the app. We discussed how the endocannabinoid receptor, because it's present in different areas of the brain, different areas of the body, has multiple different consequences in the body, whether it's activated by endocannabinoids or THC. We discussed all of that. Let's focus on endocannabinoid receptor 1 releasing dopamine, which we did discuss, in the nucleus accumbens and or striatum due to the endocannabinoids or cannabis. Endocannabinoids and THC cause the release of dopamine in the nucleus accumbens / striatum. Dopamine causes euphoria, which is the same as reduced dysphoria. This is why patients experience cannabis as reducing anxiety and depression initially, not just patients, but anybody generally, or in most cases. But earlier we said the evidence was that regular cannabis use can increase anxiety, depression, and cognitive dysfunction or inattention. What explains this difference? One possibility is the theory of receptor downregulation. You may be familiar with this theory. In the 1990s or earlier, researchers found that repeated substance use leads to downregulation of some receptors. Subsequently, researchers have found that endocannabinoid receptors are one of the types of receptors that appear to be downregulated. So initially, cannabis use causes euphoria with decreased anxiety, decreased depression, and decreased inattention, although the effects on cognition are complex, as we mentioned. But over time, receptors could downregulate or become less effective over time. So we'll have an animation of that. So basically, downregulation of CB1 receptors. As that happens, euphoria decreases and dysphoria increases. And this could lead to the patient presenting at your clinic with a concern of anxiety, depression, or inattention. Now, is there any evidence for this theory? There is evidence. According to the textbook, the American Society of Addiction Medicine, Principles of Addiction Medicine, there's the citation there, the reference there if you want to take a look at that. Tolerance develops to the pharmacological effects of cannabinoids in a variety of animal species, including pigeons, rodents, monkeys, and rabbits. The precise mechanism of tolerance is unknown. Most research focuses on receptor mechanisms such as receptor inactivation or desensitization or decreased receptor number, downregulation, which we discussed. Is there evidence of this theory of downregulation in humans? Yes, there is. A very interesting study by NIMH and the National Institute of Drug Abuse found evidence of lower endocannabinoid receptors in some area of the brain in regular cannabis users. There's the name of the article down there, and if you want click a link to the article itself, go ahead and click the asterisk. So what they did is they measured the amount of it's a very interesting and elegant study, I think. They measured the amount of CB1 receptors in the brain by using a PET scanner and a radioligand that binds to CB1 receptors. They did a PET scan on 30 regular cannabis users and 28 subjects who don't use cannabis. Regular cannabis users had 20% fewer endocannabinoid receptors in the cortex than non-users. I think it's an important finding. This study has one more important finding about endocannabinoid receptor levels, the second half of that study. We're not going to talk about it now. We will review it in the support chapter of the app. So this is my illustration to show the relationship, the dynamic relationship between endocannabinoid receptors, dopamine release, depression, anxiety, and inattention, and cannabis use. Let's take a look at the graph. In the normal state, without cannabis use, there is naturally occurring endocannabinoid receptor 1, and dopamine is naturally released, and this is the normal functioning. Now, if cannabis is introduced, each cannabis use will cause a release of dopamine. We saw that earlier. Look over to the right, and there's part of that illustration where we saw the study in 2015 where use of cannabis causes release of dopamine. That's represented in the graph by these spikes. Each spike would, in the schematic curve, would represent one individual use. You can see the rising of dopamine. This also takes place with cigarette smoking. There are similar graphs for nicotine and dopamine. So as dopamine is elevated and released, which we've seen, look what happens with depression and anxiety. As dopamine is increased, depression, anxiety, and inattention go down. This graph right here as it stands is the part of the graph that the cannabis companies are marketing and presumably making billions of dollars off. And this is a true aspect of the graph. What I would suggest is this is only part of the time course of the graph, but this graph is accurate in and of itself, at least in theory, according to the scientific information, and that's what is being marketed. However, the information in the scientific literature, as we've seen from the PET scan study, shows that regular cannabis use leads to decrease in endocannabinoid receptor 1. We just saw that. How long and how frequently cannabis has to be isn't entirely clear. In that study, folks were using cannabis regularly for a number of years, so we're not talking about weeks here. And as endocannabinoid receptor goes down, that's the purple graph, you can see that dopamine goes down as well. Why is that the case? Because we already discussed and established that endocannabinoid receptor 1 is needed for dopamine release. The endocannabinoid receptor goes down, dopamine release is going to go down. What's that going to do for depression, anxiety, and cognitive problems? It's going to increase problems. It's going to be a state of low dopamine with chronic use. What hypothetically is going to be the response of the user to decreased dopamine, increased depression and anxiety? It could lead, and there's evidence that it could lead, to increased cannabis use. This would be an understandable response, and for folks with addiction problems, this is likely a big part of the addictive cycle. There's references there for that. This evidence suggests that regular cannabis use over time, not infrequent cannabis use, but regular cannabis use over time can raise the risk of anxiety, depression, and inattention. We're going to look at some studies that are going to demonstrate this specifically. But if regular cannabis use causes anxiety, depression, and inattention, why would the student or the patient say, but doc, weed helps my anxiety, which people have told me that. Well, let's take a look at different segments of the graph. In the short term, there is not full tolerance to cannabis, so cannabis use, seen by the increasing green arrow, still does lead to increase in dopamine, some dopamine release, that would be down here, and some reduction in depression and anxiety and inattention. So in the short term, the patient is not lying when they say cannabis reduces their anxiety or improves their mood or their attention. They're telling the truth. That is their experience. It's just in a question of the time segment and the relative changes. Taking a look at the larger scale of the graph, this is the larger scale that would suggest that regular chronic use, for some, not for all, certainly for other substances, can lead to dysphoria, depression, anxiety, and cognitive problems. So this is the scale of the graph that treatment can emphasize and people can often come to understand and appreciate with treatment. If these curves are true, there should be studies showing that frequent cannabis use causes anxiety, depression, inattention, and cognitive problems. Are there studies like this? Not all studies show this correlation, and also this correlation is not often directly studied. It's sometimes an indirect finding in studies, but nevertheless, there are interesting studies that do show this, and here are a few of them that I've included because I think they're interesting and I think they are helpful to know. This is a study called Cannabis and Anxiety and Depression in Young Adults. It was a large prospective study. I do not know how to pronounce the author's surname. But the study showed, and you can find the link there, you can read the study. It was an impressive study that followed over 3,000 Australians, and there does seem to be a good analysis of Australian and New Zealand youth regarding cannabis use. I don't know if it all comes from one study, but it looks like it was a major undertaking to gather this data. And this is one outcome or one study of the data that was collected. The study examined the age of first use of cannabis use and the effect of frequent cannabis use. Those subjects that used cannabis before the age of 15 and those that used frequently had a higher rate of anxiety and depression. I think the study probably mostly focused on the first use. That's less the focus of what I'm discussing here, but fortunately they also included the frequency rate. And this rate of more frequent use and earlier use being associated with high rates of depression and anxiety was true whether or not the person was using other drugs or substances as well, which I think is important. Let's take a look at another depression and anxiety study. This is by Patton. Cannabis use and mental health in young adult people, a cohort study, and there's the reference. You can click the asterisk for the actual article. This study tracked cannabis use, depression, and anxiety in over 1,600 young people over several years, so a longitudinal study. They found that women that used cannabis daily reported 5 times more depression and anxiety, even after controlling for other factors. Interestingly, and it somewhat runs counter to this app, but it's worth noting because all the scientific information is worth noting. Young men in the study did have an association, but not nearly as strong as the women. Of note, the researchers found that depression and anxiety did not lead to future cannabis use. I think that's interesting because sometimes the idea that people use substances to self-medicate, that could be true in certain circumstances. I talked about the possibility of folks with PTSD possibly experiencing benefit from using cannabis use initially. But I don't know if all substance use is truly self-medicating, and this study indicates that depression and anxiety did not cause people to generally use cannabis more often. Interesting finding. Next study is on suicidality, all obviously related to dysphoria, also obviously related to depression and anxiety. Studies entitled Young Adult Sequelae of Adolescent Cannabis Use in Integrative Analysis by Sillins, if that's the correct pronunciation, and you can find the original article there, interesting article. This was part of a series that followed adolescents and young adults in Australia and New Zealand, as I mentioned. They followed over 2,500 youth, and it says cannabis use and several different outcomes. For youth that used cannabis once a week or more, but less than daily, the odds ratio of a suicide attempt was 4.23 versus non-users. So that's using once a week or more. For those that use daily, the risk was even higher. So there's a dose-dependent relationship, at least in this study, of frequency of use and suicidality. Interesting finding. Another study, Neurocognitive Consequences of Chronic Cannabis Use, a systemic review and meta-analysis by, I don't know how to pronounce the last name, but you can see the original article there if you like. This is a meta-analysis that reviewed 13 studies looking at chronic cannabis use and neurocognition. Again, here the focus is here on cognition and attention, and the fact that many patients report concerns of inattention and what to do about that when there happen to be for those that are reporting frequent cannabis use, if they are. The study found, quote, the meta-analysis revealed an association between chronic cannabis use and cognitive impairment in a broad range of functional domains such as cognitive impulsivity, cognitive flexibility, attention, which I've highlighted, short-term memory, and long-term memory. And there are other studies that illustrate the same thing. I include this because it was a meta-analysis. Another study on cannabis and PTSD, which we refer to, and this is the specific study I was talking about earlier about PTSD and cannabis use. This study is called Marijuana Use is Associated with Worse Outcomes in Symptom Severity and Violent Behavior in Patients with PTSD by Wilkinson. Original article is there at the asterisk. So, very interesting study. They took over 2,000 veterans that went to specialized PTSD units. This was more than one unit, and obviously this is over several years. This is a very large group of patients. And they broke the veterans that went to the PTSD units as folks that never used cannabis, people that had used cannabis but stopped during treatment, people that continued to use cannabis through treatment, and people that started cannabis use. And that made me think, why would people start cannabis use during treatment? Well, it turns out that there was simultaneously increased, we referred to this earlier, increased quote-unquote medical marijuana, end quote, and so these are folks that participated in that. So they broke the veterans down into 4 groups based on cannabis use. After 4 months after treatment, those that continued to use or started to use had worse PTSD symptoms than those that never used or people that stopped. So if these people began to use cannabis for quote-unquote medical marijuana, they got the opposite result generally that they were seeking. Their symptoms got worse, not better. Very elegant study. Also, continuing users and starters had more alcohol and other drug use as well as more violent behavior. Sometimes there's an idea, and there are authors who've commented on this, that somehow cannabis will reduce the opioid epidemic. There's no, politicians speak of this, but there's no evidence of that. All the evidence I haven't discussed it in detail here, but there's some evidence here. All the evidence is that that is not the case, and the study supports that. The authors comment on violent behavior. They think some of the violent behavior could be a factor related to alcohol use, but they also make an interesting comment specifically in the article that sometimes cannabis is associated with people being more peaceful or less violent. The authors feel that that is a false stereotype and generally is not true. There is one more interesting finding here, another interesting finding. That is that those that stopped cannabis use had the most reduction of PTSD symptoms than any group. They even had a greater reduction in PTSD symptoms than those that had never used cannabis. Well, how could that be? Shouldn't it be at least the same as the never users? Maybe less, but at least the same? Well, it makes me think, in the light of what we're talking about regarding the endocannabinoid receptor, that some of the quote-unquote symptoms of PTSD that they were using could be related to the dysphoria of regular cannabis use. That's my comment. The authors don't comment on that. It's just a provisional idea I had related to that interesting finding of the study. So, can CB1 ever be upregulated? Is this all bad news or what? I said at the beginning this was generally meant to be an optimistic lecture, and there is good news. There is good news that these curves can be reversed, and there's very compelling evidence that CB1 receptors can be upregulated, which is very good news and maybe not expected. We'll find out more when we look at the